Graduated with honors in biochemistry from the University of West Indies. He's a distinguished cardiology consultant at the University of West Indies in internal medicine and cardiology, with particular emphasis on stress testing. He does research involving post-myocardial infarction and incidence of mortality post-myocardial infarction. He's no stranger to us, and he's a champion old boy. Ladies and gentlemen, Dr. Mark Hosang.
Okay. Morning, everybody. This morning we're going to be talking about stress and cardiac disorders. So I know all of us are subject to stress in one way or the other. And my role here today is to say, well, how can this stress impact us in the long run, and sometimes even on a short-term basis? So what is stress? Stress is basically the body's response to changes that create taxing demands. This can either be a physical type of stress, or it can be mental or emotional, psychological kind of stress. Stress is divided up. It can be divided into acute stress or chronic stress. Acute stress is usually there is some immediate traumatic event, something very sudden. You receive very bad news, or you're in an accident, or it might be that you actually witness a traumatic event. For example, somebody being in an accident or other hazardous scenario. Chronic stress is probably what most of us think about when we talk about stress, and it's stress over the long term, and it's a response to emotional pressure over a prolonged period of time. Usually the individual will perceive that he or she has no control over the cause of this stress. Stress can also be divided into positive stress, also referred to as eustress, and negative stress, which is often referred to as distress. Positive stress can be a good thing. Well, it is a good thing. That's why I refer to it as positive. And it's very good as a short-term motivator and can be used to improve performance. For example, you know that you have an upcoming presentation, and you feel very moved to do the necessary. Can't see that screen. All right, sorry. So you're moved to, it motivates you to get the job done. And that can be a good thing, because all of us here are relatively high-functioning individuals, and we're all about getting the job done in one way or the other. However, negative stress usually produces some form of anxiety or concern, usually associated with a very unpleasant feeling, and can actually decrease your performance and is perceived as outside of the individual's ability to cope. And which is different from the positive stress, where you have an improvement in your performance. With negative stress, sometimes we all spend so much time worrying about all the things that we have to do. It reduces our productivity. Or if you're an athlete, if you're at the starting line, you can imagine you're so nervous that your muscles can get very tight, so when you hear the gun go off, you are slow to get off the mark. And that's a perfect example of the negative impact of stress. So stress is the body's natural response to demands. I think I kind of said this already. And positive stress, again, emphasizing that it can feel exciting, and it helps you to meet the challenges that you have to overcome. However, negative stress or prolonged negative stress can lead to potential life-threatening diseases, which can involve more than one element in our different systems, cardiovascular system being one of them, and of course we have other presenters who will discuss other aspects. So one of the things that we think about is, what is the effect of stress on coronary artery disease? And there has been some amount of data about this. Here is an example of a study. I think this was done by Duke University, where they selected 132 patients who had evidence of coronary artery disease. So usually these patients, I believe they had a positive stress test, which showed evidence of ischemia. And they enrolled these patients, and what they did was they put on a 48-hour ECG monitor, which is a Holter monitor. It's a very small device, usually about the size of, for those of you who may be back in that age, a Walkman, which you would, well, some of you may not understand that reference, but, you'd wear it around the neck, and it's very similar to an ECG. It has all these cables attached to you, and it records the rhythm of your heart over a period of time. And in these patients, they had this recorder on for 48 hours, and not only does it record the rhythm, but it records a part of the ECG called the ST segment. So what they looked at was that for patients who have ischemia, there are very classical changes that are produced on this ECG, which is described as ST depression. So I know most of you are probably not familiar with the ECG or all the different waves, but there's a portion of the ECG which is a bunch of squiggly lines where actually it becomes depressed, and we can see that when reviewing these studies, and it is interpreted as meaning that the patient has ischemia. And what they did was that they gave these patients a diary, and they had to record whether they were frustrated or sad, or there was an episode of tension. And they looked back at this, and due to all the recordings, and they saw over the hour after these reportings what was the, if there were any changes on the ECG. And what they saw was that 58 out of these 132 people did demonstrate episodes of ischemia, as seen on the monitor, and there was a greater than 2 times risk of ischemia in the subsequent hour after they had reported the symptoms of stress, whether tension, frustration, or sadness. There's also a relationship between stress and myocardial infarction. There have been certain studies that have been done after certain natural disasters. For example, the 1994 earthquake in Los Angeles. And what they did was they reviewed the coroner's records, and they saw that there was a significant increase, almost a 5 times increase in the mortality immediately after the earthquake, when they compared it to previous years of the same time. Because in previous years, the average was about 4.6 deaths per day from a myocardial infarction, whereas right after the earthquake, it went up to 24 deaths within that first week. And it was noted that 16 of these patients had symptoms of chest pain or died within the first hour of the event. And they managed to compensate for activity, because of course people be running to try to get cover or trying to clear out debris, and they tried to account for the level of activity, which may also be a confounder in a myocardial infarction. And from this, their conclusion was that emotional stress may precipitate cardiac events in those patients who are predisposed to it. So most likely these patients had some underlying coronary artery disease, but they just needed something to tip them over the edge. Sporting events can also be stressful. For those of you here who watch sports and you have your favorite team, and it's a very big event, especially like a World Cup or a finals game. I don't know if anybody watched the game last night between Oklahoma and Golden State. But it was down to the wire where Oklahoma was ahead, and then they gave away the lead. And if you're an Oklahoma fan and you saw that going away, the effects on the heart can be quite severe. But they've actually studied this, and a lot of the studies have been done in Europe, usually with football games, real football, not what the Americans call it. But there's an example of an increased incidence of myocardial infarction in a finals game between France and the Netherlands in 1996. This game went to a penalty shootout where they noticed an increased incidence of myocardial infarction in men in the Netherlands. Well, they felt that, probably more men were watching the game as opposed to the women. And it seems to be more in the Netherlands as in France because I guess they weren't as emotionally invested in that kind of game. There was another study done between England and Argentina in the 1998 World Cup where there was they noted an increase in the admissions for heart attacks or myocardial infarctions by about 25%. And in this case, both men and women were affected equally. No, this is not for every single sporting event, and when you look at not every major sporting event will have such a significant impact. And I think that might be directly related to the importance at which the people put in these games. The mechanisms that are thought to involve with this increase in cardiac risk are thought to be due to increase in sympathetic innervation, which results in an increase in heart rate, an increase in blood pressure, as well as an increase in myocardial contractility, all of which increase the demands of the heart and may potentially make a plaque or atherosclerotic plaque more unstable and likely to rupture at that point in time. It also causes an increase in oxygen demand, which can result in ischemia. Next thing is stress-induced cardiomyopathy. Most of you might not have heard much about this, but there is a condition that is known as Takotsubo's cardiomyopathy. That's from a Japanese word, which is, refers to an octopus trap, which was like a pot. And the reason for that is because in this cardiomyopathy, you have apical ballooning. So when the ventricle looks like a pot, and I'll show you a picture of that very shortly. Usually this is transient, a transient cardiac syndrome, and usually it is precipitated by a stressful event. Not just emotional, but also physical stress. And this is usually seen as akinesis, or a lack of motion. A meaning absence of, and kinesis meaning motion. So an absence of motion of the apex of the left ventricle, which is the main pumping chamber of the heart. This syndrome can often be confused with an acute coronary syndrome because it usually presents with chest pain. These patients can have ST elevation, which is very classical of certain types of heart attacks, and usually in the ECG leads on the front of the chest. And it is also associated with an elevation in the cardiac enzymes, even though this is usually not as high as in patients who do have a myocardial infarction. Here we have the pot. This is the pot, so the octopus would go in there and he would get trapped, and that's how they'd catch him. And then on the left, we have an example of the ventriculogram. So this is where we inject dye into the actual chamber, and you notice that here, this is the apex of the left ventricle, and it looks, if you use your imagination, a little bit ballooned out at the end right here. And this is in systole, when the heart should actually be contracting and should actually be smaller than at other times. For the diagnostic criteria with Takotsubo syndrome or cardiomyopathy, there's usually a transient hypokinesia of the left ventricle, and it is usually beyond a single arterial territory, because usually when you have a heart attack, you have a blockage in one vessel, and it's that area of the heart that stops moving because it's not receiving enough oxygen and it dies, the muscle dies. But this condition, you can have it in more than one arterial territory, and it is usually precipitated by a stressful trigger in over 2/3 of cases. When we take these patients on to do coronary angiograms, the coronaries are usually normal or with very minimal disease that would not explain a possible infarct or new ECG abnormalities. There's also an elevation in your troponin, as I'd mentioned before, and you also have to consider other differential diagnoses such as myocarditis, which is an inflammation of the heart, or pheochromocytoma, which is a condition where the body produces more adrenergic or sympathetic hormones, usually due to a tumor of the adrenal glands. It is thought to be due to a stress-induced catecholamine release, which causes toxicity and stunning of the myocardium. They have done studies with rats where they've injected them with more catecholamines, and they have induced this kind of changes in their heart. Other mechanisms that are thought to be involved are multivessel spasm, so it's more than one arterial territory, or actual thrombosis within the vessels, and in certain cases, actual epicardial vessel occlusion. It is thought that the apex of the heart is more involved, which is why you have this ballooning out of the heart, because there are more receptors involved with sympathetic innervation in that region. There's an international registry for this condition where the majority of these patients tend to be women, 90%. It's actually physical triggers more than emotional triggers that tend to be common, 36% versus 27%. However, in about 29% of patients, there is no discernible trigger. Okay? And the groups that tend to be affected more by this condition tend to be either Caucasians or of Asian origin. It can be complicated by heart failure. They can go into shock. They may develop arrhythmias, usually ventricular arrhythmias, which can be life-threatening, so therefore it can lead to death. And sometimes because of the damage to the heart muscle, you can actually have rupture of the heart, again resulting in death usually. For those people who can survive the early period, most of them recover. 95% of them will recover within a short period of time, 4 to 8 weeks. Stress may also induce irregular heartbeats or very fast heartbeats. It is known that acute emotional stress versus a chronic type of stress, because when we're all under stress, we all tend to fall back into certain comfort patterns, things that make us feel comfortable. Some of us have comfort eating. Some of us, unfortunately, smoke. And some of us also consume ethanol. And these other... well, I'm sure most of us consume ethanol to some degree. I'm talking in excess. So these things can also lead to issues long-term in terms of your cardiovascular health and subsequent complications. So smoking is probably one of the most dangerous things that you can do. Smoking is one of the most dangerous things that you can do. Because it causes an increase in free radicals and inflammation amongst the blood vessels, as well as increasing atherosclerosis formation in the blood vessels, leading to accelerated or earlier atherosclerosis. So it leads to the plaques, which can lead to coronary artery disease, such as myocardial infarction and potentially strokes. But it also, because of the increase in inflammation, it makes these plaques more vulnerable. And when these plaques are vulnerable, they're more prone to rupture. So when these plaques break open, they expose collagen, which is within the plaque, to the bloodstream, resulting in thrombosis. Because once the blood comes in contact with that, it activates a coagulation cascade, and it results in a clot within that blood vessel. If that clot occurs in the blood vessel of one of the coronaries, then that leads to a myocardial infarction. An acute block, no blood is flowing, no oxygen is going down there, that muscle dies. That's basically what happens in a heart attack. And a stroke is the same process, just occurring within the intracerebral blood vessels. Alcohol is also a very important contributor to cardiovascular disease because it can result in direct actions on the actual heart muscle, resulting in weakness. There is something called the alcoholic cardiomyopathy, which is where you have weakness of the heart secondary to the direct toxic effects of the alcohol, but there may also be as a result of lack of certain micronutrients, because a lot of people who are alcoholic drink alcohol to the detriment of other nutritional agents. And there are a lot of micronutrients that may be absent, which is thought to lead to development of this cardiomyopathy. So these patients usually present with heart failure, which is where the heart is not pumping sufficient blood because of the actual weakening of the heart. So they get very short of breath, they get swelling of the limbs, they can't lie flat. And this most patients who do develop alcoholic cardiomyopathy do tend to have a good prognosis once they stop drinking. The heart failure is approached with the usual types of medications that we give them, the ACE inhibitors, the loop diuretics, the beta blockers, once there's LV dysfunction. Right, but they usually recover spontaneously once the alcohol is discontinued. Alcohol may also cause problems with rhythm disturbances. There is something called a holiday heart, where people go on a holiday, they go and they binge drink, and because of the high concentrations of alcohol, it actually induces an arrhythmia called atrial fibrillation. So we see this from time to time, and I know that most of you are familiar with atrial fibrillation and the agents that we use, such as warfarin, as well as other rate control agents, such as the beta blockers or the non-dihydropyridine, calcium channel blockers, and in some cases, agents such as amiodarone, depending on the situation. So usually these tend to be transient and due to the acute stress of the alcohol. So, you know, when everybody has had a very stressful week and they get that long weekend and they go drinking, you can have a number of these problems arising. Right. Anyway, but fortunately, the acute alcohol-related disorders tend to be transient and can recover once the patient abstains from alcohol. Hypertension is another thing that may also result from stress. Hypertension is something, or an increased blood pressure is something that we all think about when we consider acute stress. Where are we? Blah, blah, blah. Stress and smoking. Yeah, I think we said all of this. That you use it to deal with different parts of stress. Smoking releases dopamine, so you feel better and more relaxed, but increases risk of coronary artery disease. It can also cause a result in your blood pressure because it causes more adrenergic stimulation, vasoconstriction, increase in your heart rate, endothelial dysfunction, and of course increased thrombosis and oxidation of your LDL. Active smokers have an 80% increase in their heart attack risk, but it's not just active smokers, and I forgot to talk about this before, but also it's important to remember that passive smokers, people who are just beside those people who are smoking, also have an increased risk, a 30% increased risk of having coronary artery disease. And it leads to all the spectrum of coronary artery disease, being from stable angina to the acute coronary syndromes, as well as peripheral arterial disease and strokes, as well as aortic aneurysms. Alcohol, as we had mentioned before, can lead to arrhythmias, the cardiomyopathies, but also it can lead to an increase in blood pressure. There's actually a J-shaped curve associated with consumption of alcohol, where at lower doses, 1 to 2 drinks per day, there's said to be an increase, a reduction in mortality, and this is thought to be due to a decrease in platelet stickiness, as well as an increase in the lytic activity of the bloodstream. But as you go higher, because of the direct effect of the alcohol, which you feel most of that is being driven by the effect on blood pressure or hypertension, it then again starts to increase the risk of mortality and morbidity. Oh, and also it can increase your HDL, and as we had mentioned, decrease your platelet function or platelet stickiness and lytic activity. Right, and stress we normally relate to an increase in blood pressure, usually, but contrary to popular belief, it does not actually lead to hypertension. And there's no evidence that stress or emotional stress actually leads to hypertension. It can cause an acute transient increase in blood pressure, but there's usually no long-term sustained elevation. And this is thought to be due to an increase in catecholamine release. But we do know that things that are useful for reducing stress can also help to reduce blood pressure, such as meditation and biofeedback or music therapy. But in our current life, where these acute stresses now become a chronic problem, where we're always connected, we're always going, that acute stress now starts to stretch out over a longer period of time, and this may actually change how we look at stress and hypertension in the future. So in conclusion, stress can potentially cause many cardiac disorders. not necessarily directly, but there are also other indirect lifestyle changes that we fall back on when we're under stress. And the response to stress and how we may modify our response to stress may also modify our risk of mortality and morbidity. Thank you.
Thank you very much, Dr. Hosang. Exactly half an hour. Excellent. Secondhand smoking doesn't necessarily mean a cigarette or a stick of weed. Persons who have those cars that smoke, please attend to them. Because I don't have AC in my car, so I have to use the breeze. So please attend to those.